Welcome. For those of you who've just joined, this is a Social Work Week 2024 session, Why and How Pets Matter, bringing animals into our workspace. I'm Kate Metcalfe. I'm one of the regional engagement leads at Social Work England. I cover the south of the country. I'm also a registered social worker as well. So just going to walk you through the legal bits. So any views, information or opinions expressed by third parties during Social Work Week are the speaker's own and don't necessarily reflect the views of Social Work England or its employees. We have not endorsed any third-party content and don't accept liability for the content of third-party or sector-led sessions during the week. Bit of privacy notice here. So obviously your information is important to us, as is your privacy, and your personal information that you share with us, such as your name and email address, will only be used by us for the purposes of event management and evaluation. And your personal information will be used solely for the purpose for which it's collected. And that data will be retained up to 3 years in accordance to our data retention schedule. So without further ado, I am now going to pass you over to our speakers for this session. So over to Mary and Rebecca, who are going to talk to you about this amazing subject, and I hope you enjoy the session.
Oh, hi. You'll notice from my accent that I am from the United States. My name is Mary Elizabeth Rauktis. Thank you for inviting me to talk about this today. I teach at the University of Pittsburgh, and I work on human-animal interaction, as well as treatment, foster care, and residential care. Rebecca?
Hi, I'm Rebecca Stevens, Senior Lecturer in Social Work at the University of Sussex, and I'm also the Co-Director of Education with the International Association of Veterinary Social Workers. So first of all, I'd like to wish you all a very happy Social Work Week, which goes without saying. So the focus of this session today is really to shine a light on the importance of considering companion animals in the lives of people you support in your practice. And we'll be talking about the role and impact that pets have in people's lives and how this is relevant to social work. We'll also be talking about veterinary social work and where the opportunities are to build new interdisciplinary partnerships. So I'm going to hand over now to Mary just to set some context.
Next slide, please. So the United States and the United Kingdom have some similarities. Pet ownership is high in both countries. Pets are considered family, particularly in the United States. And there's a fair amount of research from both the UK and the United States and other countries about the value of pets for our health and well-being, depression, particularly cardiovascular health. And during COVID, some studies about the role of animals in reducing social isolation. So we know that animals are part of people's lives. Next slide, please.
So as you've just heard, half of the population of pet owners consider their companion animals as family. And because of this, people will care for, treat, and even refer to their pets similarly to how they would their human family members, because animals really can have unique relatability. So it's important to acknowledge this in the context of appreciating the human-animal bond, because people really do make life decisions with their pets in mind. So when we refer to the benefits of caring for an animal, this can be considered as natural benefits. So these are the everyday experiences with the animal through positive interactions, and task-trained benefits when the animal is taught to perform specific tasks. And this is the case of service animals and emotional support animals and alert animals. There's been a number of studies that associate the presence of animals with a reduction of stress and blood pressure. And there are recent discoveries actually in biomedicine that has shown surges in oxytocin in both dogs and humans during positive interactions. Some research came out recently, as last week, that demonstrates when children and dogs interact, the stress hormone cortisol is decreased in both species. And an animal companion or a pet is often considered an important attachment figure, sometimes a primary attachment figure. And this is especially true from research with children experiencing life adversities who often view their pet as a secure base and a positive role model. There's also been a lot of other studies that evidence how animals experience feelings like joy, fear, and even show moral conduct like emotional contagion and affective empathy. And it was only in 2022 that animals were recognised as sentient beings in UK domestic law. So this has really important implications for professionals working in human and animal related fields. We have the next slide, please. I think it's really important to appreciate the value that people place on their pets because they really can impact the decisions people make, from simple decisions to major life decisions. And people will often put the needs of their companion animal ahead of their own because it's that bond that someone has with their animal, which might also influence decisions around healthcare, going into hospital or a care or treatment facility, or temporary accommodation. So this is also really important to consider because access to pet-friendly emergency and support services can be a real barrier for people. I think it is important to consider the areas of health and well-being that animal pets can impact because, quite frankly, a pet can literally be someone's will to live. And there is evidence that people won't carry out their suicide plans because of the relationship with their companion animal. So instead, because of that bond, they plan for survival. And this is where attention to the human-animal relationships and social work is really crucial because knowing the ways in which a companion animal can impact someone's life can give clues to risk and resilience factors, particularly when that bond is threatened or compromised. So I think the key message here, if there is one thing you take away from this session, is that it's actually not about the species, the breed, or even the size of the animal. It's about the bond that is important to consider. We have the next slide. So when there is a change in the connection with a companion animal or a threat of experiencing a change through loss, whether this results from an expected loss, like a planned euthanasia or rehoming an animal, or a traumatic loss from an accident, or even an ambiguous loss, like if the animal goes missing or is stolen, the grief that can result has similar parallels with grief responses when a secure human connection changes in terms of the intensity and the duration. So as social workers, you'll be familiar with the various models of grief, but all of these to date reflect human responses to grief. So Blue Cross Pet Loss Support Service created one, which is reflected on this slide, to reflect some common grief responses from pet owners. So you can see one of the main ones is around the anticipatory grief, and responsibility grief is a major experience for people, particularly where an animal might be harmed, injured, or even died through an accident that possibly could have been prevented or avoided. So using a model like this can support grieving pet owners to recognise and process their emotions. And this is really important because the experience of pet bereavement is not generally socially acknowledged or validated and is often minimised. So the experience of loss is compounded by disenfranchised grief. So what is important to appreciate that for many people, there may be grieving the loss of the only source of unconditional love in their life, or the loss of their animal might have been the last living link to a loved one who may have died. And in the case of a service animal, the loss of some really important, significant life support. So if you remember the statistics we discussed earlier in terms of the gains of caring for a pet animal, where the animal no longer features in someone's life, a range of secondary losses can result, which can impact the biopsychosocial aspects of people's well-being. It's also really critical that we think about the impact on the mental health side of pet loss, because the rate of suicidal ideation following pet loss is real. There were some findings published just last week from Blue Cross that found half of the UK's pet owners felt they had to suffer in silence after losing a pet. And so it must be recognised that it's never just an animal and people can't just get another one. We have the next slide, please. So child and animal welfare have historically been distinct and separate practice areas. However, there is established evidence of the correlation between child abuse, domestic violence and animal cruelty, which has been coined the link. And Phil Arkow has done a lot of work in this area, and this statement really rings true. So when animals are abused, people are at risk, and when people are abused, animals are at risk. So I just want to hold on to that thought as we move on to the next slide, please. Victim survivors will often delay leaving abusive relationships or return to them in fear of what might happen to themselves, their children, or their pet when an animal is used as a tactic to coerce, control, and silence family members. From research, we also know that children who frequently witness animal abuse within the home may intervene to protect their pet, but they also might harm their pet because witnessing animal cruelty may become normalised. So I'd like to draw your attention here to the animal abuse wheel. This has been adapted from the Duluth Power and Control Wheel, which you're probably all familiar with permission from the Domestic Abuse Intervention Program, following one of my wonderful colleagues, Mary Wakeham, who did some research with over 100 survivors of domestic abuse. And this wheel reflects the narratives of those survivors. This is a useful resource for you to use, and the reference is down the bottom there. You can access it online. And you can use it if there is animal abuse or threats of abuse to facilitate those difficult conversations. And it might be helpful also to share this with survivors who may feel helpless to protect their pet animal. So abuse to humans and animals are both potentially prosecutable offences in England. So it's even more important to understand the link, especially for those of you who regularly visit people in their homes. I think if our approach is truly relationship-based, then I would argue that we should be seeing as pets as victim survivors too, and respond to safeguarding concerns as they relate to vulnerable humans and companion animals. So I'll hand over to Mary now to continue on. Next slide, please.
Thanks, Rebecca. Thanks for setting this up like this. This is great because it takes us right into veterinary social work. So veterinary social work touches on several of the areas that Rebecca's already discussed. So intentional wellness is one I will address on the next slide, but pet grief and bereavement, animal-assisted interventions, service animals, as well as in the US, we have emotional support animals. And then the link, which Rebecca talked about with the intersections of child, intimate partner violence, and elder abuse with animal abuse. I'm actually going to focus on the next slide, next couple slides about the intentional wellness piece. So in the United States, we have several universities, schools of social work who do focus on veterinary social work. Sadly, not my university, but the University of Tennessee has a certificate program that anyone, you don't have to be a social worker, can engage with. Also, the University of Denver tends to focus on more animal-assisted work. So working with animals therapeutically, and also the Cleveland State University, where my colleague Aviva Vincent is moved to, is now starting a certificate program for veterinary social work. So it's very much a subspecialty in the US at this point, but we hope to see more schools begin to address this in their curriculum. So next slide, please. Because let's face it, if climate disaster has taught us nothing, it should have taught us that one health, one welfare is critical. That when we see pictures of people rescuing, puppies and kittens and dogs in floods and during hurricanes, it reminds us that we all coexist. So the framework for one health and one welfare, which comes out of veterinary medicine and public health, envisions humans and animals in the environment as interconnected. However, unfortunately, the research has tended to be very human focused and unfortunately not as animal focused as it should be. So I prefer sort of the term what I call eco-health. So rather than viewing animals as a zoonotic threat, right, with pandemics or other or animal bites, which is often what the research will focus on, eco-health recognizes the dynamic linkages between the health of all species in the environment. Today, when I'm done talking with you, I'm leaving to do a One Health clinic that we call the Humane Health Coalition. And it brings together in a van, it's mobile, so our veterinary team will be out in the field. As I'm talking, I see out of the corner of my eye, one of my cats getting ready to jump up here, just saying. So we will be out in the field. We use this clinic to bring people in to get their animals checked and for minor procedures. And while their animals are being checked, we work with on the human side. We do screenings, HIV, we do vision screenings, we do health, we do nutrition. So it's actually bringing to communities this idea that you're here for your animals, but also be here for yourself, because working with animals is a way into humans. Next slide, please. So veterinary social work, I mentioned that one of the areas in the US that we are working on is a specialization in veterinary social work. So why would we do that? There are a lot of reasons for it. I will keep it brief, but we have talked to about 125 veterinary social workers and shelter workers who are working with veterinarians and their staff. And we did a survey. We've also done some qualitative work. And what we found is that these social workers work with both humans and animals, similar to the One Welfare model. However, they work with them on different issues. So for pet owners, as Rebecca talked about, there's grief, often unrecognized grief. So they do a lot of quality of life work. They do a lot of unresolved grief work. It's usually fairly brief intervention, but it's important intervention for the owners of the companion animals. The other half of the equation is that they work with the veterinarians and the veterinary staff. If you've worked in the veterinary field, similar to the medical field, sometimes people don't like to talk about the difficult things, but we know that it does impact them in a very negative way. We know that in the United States, and I believe in the UK as well, and here comes Mr. This is my beautiful rescue big cat Orion, but it's time for you to go down here, buddy. All right, so we know that they experience high rates of depression and suicide. And in fact, in this study that we asked social workers about the degree to which they've worked with people who express suicidal ideation, and about a third of the time they're working with staff on these feelings of grief and despair. Why is that? A lot of reasons. Some personal, people come in the United States with a lot of debt. As you know, our educational system is self-financed. So they come in with a lot of debt from veterinary school. They work long hours. It's physically intense work. And people often come in who like animals, maybe not humans so much. Maybe they're not necessarily people who will express how they feel. And there's also some disputed research around whether or not if you work in a field where euthanasia is one way of dealing with grief, with pain, that perhaps it's not viewed as, and also access to drugs. So there's a lot of reasons for this, which is a lot of reasons why social work needs to be there. Social workers also worked on the pet parent side with securing basic resources such as food and supplies and just basic wellness. Next slide, please. Keeping in mind the time. So there's so many opportunities, not only for education and research and practice, which is what Rebecca will sort of spend the time. So I won't go into this in great detail, but I would encourage those of you, I mean, I'm thrilled to be talking to Social Work England. I mean, to be honest, in some ways, it's not, it is accepted in the United States. Obviously, we have programs, but we don't always, I'm always reminding my colleagues at the university, it's humans and animals, humans and the environment. So we know there's so much more to be learned about the link. You don't have to be in a veterinary office to practice across both human and non-human areas. We need to take off our glasses that in which we only look at people and we don't ask about the animals or the environment for that matter, but particularly their animals. So I would say we have a lot of work to do in social work, but the good news is that there are more of us doing this work. And hopefully by joining today, you'll become one of us. So pet loss and grief, coordinated disaster. I work with Dr. Fajeda down at Tulane. He's a disaster resilience person. Animals are impacted by that. We're doing research, coordinated intervention studies. Hoarding is a massive problem for us. And we still don't have a good way to deal to, we don't have a good intervention. Environmental social justice. I teach that class at my university. And finally, you know, cultural considerations. Not all cultures view pets, animals in the home as culturally correct or even religiously correct. So finding out more about that and practicing in a culturally sensitive way. And then last but not least, student placements in shelters. So you have Dogs Trust, you have Cats Protection. We have a couple of our students working in these areas, Goatscape, where goats are actually in communities, helping to clean up communities, and social workers use the goats to sort of have an entree into the community, not use them, but there's something about an animal that opens up a window into conversation. So I'm gonna hand over to Rebecca to finish us up. 30 minutes is not a lot of time. We could talk for 30 hours. So hopefully our conversations will continue after today's session. Go ahead, Rebecca, next slide.
Thanks, Mary. And it's a good segue into this. I just love this quote from Phil Arkow, "A pet is a communication waiting to happen." I think, excuse me, a pet can prompt and facilitate a starting conversation. And I think this is particularly true with children who might struggle to articulate their feelings. So why not involve their pet? It's simply asking, you know, what do you and Fluffy like doing together? Or what do you think Fluffy worries about? Because asking about pets might give clues to what is really happening in someone's life. And if we're going to take an ecological and whole family systems approach, then it's important, really important, and I feel quite passionate about this, to include pets on family genograms, to include them in assessments and care and safety plans, because this also acknowledges the risk and resilience factors associated with the human-animal bond. I'd also encourage all social workers to know what the basic animal welfare needs are, because if you visit people in their homes regularly, you are in such a prime position to note even simple things like how the animal is spoken about, interacted with, where the animal sleeps, even if there's food and a water bowl visible. I just want to acknowledge here, though, that whilst you are not legally bound to report your concerns relating to the welfare of animals, I do think we have a moral responsibility to report, because victim survivors of domestic abuse have widely reported, that they want justice for their animals too, and for the perpetrator to be held to account. Otherwise, they will continue to abuse the animal and maintain power and control. So it's really important to record any concerns if we want to get justice for all victim survivors, including pet animals. I do also at this point want to say I do appreciate, however, that it can be ethically challenging, particularly if reporting concerns might escalate risks to the survivor. But I think you can at least talk this through with your teams, bring it to the MARIC and other interagency safeguarding forums, and get to know your local animal welfare services like pet fostering specialist pet fostering services. So finally, I'd like to make a really important point here is you don't have to be an animal person to appreciate the human-animal bond, because it's more about being a responsible professional and appreciate that the decisions people make reflect the bond that they have with their pets. Next slide. So just some further information and links for you. So this list is by no means exhaustive, but these are some important services that support human animal welfare and also some key relevant legislation. So you'll see here the Animal Welfare Act that I was referring to earlier. This outlines the 5 animal welfare needs if you wanted to familiarise yourself with that. So I'm happy for you to take a screenshot or a photo of this page for future reference.
Really love this photo, Rebecca, because I think we underestimate the value of these animal-human contacts, like this lady feeding pigeons, people feeding colonies of community cats. These are things that are really important, and don't be afraid to ask about them, you know, are there, because this is, you know, this is actually, I work with some older adults who look just like this picture.
Yeah, I think that's really a good point, Mary. And it's, you know, it's that all creatures, great and small. And as I said, you know, it's not about the breed, it's not about the size, it's not about the species. I mean, this picture really depicts it, is sometimes it's the most unexpected bond or relationship or connection that you have with a random other non-human living creature that is so important for people.
Exactly.
Okay, so final slide, please. Okay, so this brings us to the end of our presentation. Mary and I really, really pleased with the number of people who have joined the session today, which I think says a lot about how important it is really to ensure that our practice is inclusive of all species. Mary, do you have any final words you'd like to share?
We too have celebrated Social Work Month, actually, is March, but International Social Work Day on Tuesday, and had again, a talk about One Health, One Welfare. I think it's time for at least I speak for my American social work students and colleagues, it's time for social work to really sort of step up to the plate, as we say, American metaphor there, for looking at this intersectionality. If nothing else, our climate changes are telling us that we need to be involved in the non-human spaces, just not the human spaces as social workers, in practice, in research. So thank you so much for inviting me to be part of your social work celebration. Social workers are my favorite people so I was just so happy to be invited, and thanks to Rebecca for agreeing to co-present with me. I said I don't really think an American should be talking about this alone, so thank you, Rebecca, for partnering with me.
No worries. We're happy for anyone to reach out to either or both of us, and our contact details are there.
Oh, thank you both so much for an incredible presentation. I'm going to move us on to the final slide now. Yeah, we've had a great turnout for this session today, and it's been a really eye-opening half hour. I'm sure everybody who joined us thinks the same. Just a quick reminder that if you've joined as a social worker and you've enjoyed today, and I'm sure you've learned a lot, you can use this as a piece of continuous professional development in your Social Work England account, and that can count towards you maintaining your registration with us. If you're on social media, we'd encourage you to talk about this amazing session using the hashtag Social Work Week 2024. So you can do that on Instagram. We're on Instagram Instagram, we're on Twitter, X, so do that as well. We've posted in the chat for you the opportunity to take part in a survey for social workers. We'd love you to do that. And also please do give us your feedback on the other link about today's session, which just leaves for me at 12 to say again a massive thanks to both Rebecca and to Mary for joining us from the east coast of America live with the time delay and accommodating that, and of course to your cat who joined us briefly as well. That was an incredible session and a real privilege to be able to introduce you. So thanks again, and hope to see you all again soon at another Social Work Week session. All the best for now.
Thank you.
Bye.
Bye bye.